I'm scared to even ask this, but we're going to do it anyway. So predictions for life after COVID-19, it's all over the place. Some people feel like, yes, we can start planning. Some people are like, we can plan, but not really. Just give us an idea of sort of what conversations are happening in your organization and what steps are you guys taking to plan for the wonderful day when we can go get something to eat.
I'll take a step back. And I think, you know, when Kimberly, you were talking about your hub, and we created something very similar. We created a COVID-19 resource center, and it started out as one page, and we were only decided to, you know, curate content from the CDC. And then as the disease escalated, we decided we need to expand, and we listened to the audience, and we created a bigger resource center. We had to change templates and revamp everything because our physicians were wanting to know, like, how do we treat? What do we do? How do we prevent this? How do we diagnose? How do we prepare? And so the resource center shifted. And then we had a third iteration because things had shifted again, and it became more that we were building out ethical content because the AMA has the Code of Medical Ethics, and many physicians were wondering about ethical concerns. And so we produced new content based on those ethics. And of course, we're an advocacy-based organization, and we've been advocating on behalf of the physician to help, you know, improve the patient care with COVID-19. And so we started producing more letters that we were sending to Congress and to the administration. So we've seen these evolutions. And so as we move forward and things start to reopen, if a vaccine is created, you know, the conversations that we're having is what's the next iteration of what we need to develop in terms of producing our own materials. And I should say that third iteration was when we started creating those guides that let us produce our own content for the audiences, because that's what they're looking for. And so that fourth iteration, I foresee we will continue to produce additional materials for our audiences, you know, across the landscape. We're all thinking, what is next? How do we live with this? How do our physicians, our medical students, our residents, from, you know, the point of view of AMA, how do we continue to help supporting our target audiences so they can continue to give care, get educated in that capacity for physicians to keep managing their practices. So we've started those conversations as we begin to pivot as an entire country to the next phase of where we will be.
Yeah, that sounds smart. I think, you know, when I'm hearing about other healthcare organizations saying, well, we're going to start planning for 2021, I actually heard somebody say that, and I'm like, really?
Wow.
What kind of crystal ball do you have? No.
Can't even fathom that.
I know. Yeah. I know. Lisa, let's talk about you and how you guys are potentially planning for or predicting what's next. And again, I'm picking on you because I feel like you guys have done a really excellent job of making it very clear your capacity. Like, we can test 1,000 people a day now if you're symptomatic. We have testing facilities here, here, and here. I feel like you guys have done a really good job of communicating your capacity. So how do you plan for what's next?
Yeah, so it's a combination of things. So there's, you know, like other folks have said, you know, we have COVID focused information on our site, but there's sort of like two paths here, because we want to communicate what people can do if they have COVID or think they have COVID and what we're doing around that. But what else are we doing to be available for medically necessary care that's not COVID related? How are we setting up the hospital? How are we separating those cohorts, you know, to keep everyone safe on both sides? And also, you know, our surgeons have worked on some guidelines that they've already published around, like, kind of stratifying what's truly elective and not elective, and what are the steps that need to be taken before we can do certain surgical cases, and communicating that with other physicians, but also, you know, we're doing a Facebook Live is actually happening right now, where some of our doctors are talking about, like, helping folks stay, you know, understand that it's safe to get care and what we're doing to make it safe for them. So, you know, as we're working on these plans and as we're pivoting very quickly to make the environment safe to folks, you know, obviously we have to communicate that. So that's a lot of what we're doing. And also as our own physicians are learning how to do video visits and virtual care that they were not doing before because they preferred to be a little bit more in control of their schedules, but that's out the window.
Yep, totally done. Absolutely. That is such a good point that the next step for University of Chicago Medicine and probably a lot of other hospitals is it's safe to come here. And how do you convince the public that it is actually safe to come for certain procedures and in certain areas of the campus? I think that's a very good point.
Yes. Yes.
Stephanie, how are you sort of planning, predicting for your
Well, Lisa just set me up so nicely. It's almost like I paid her to do it. She did. I didn't, but I'll nod to Lisa because what I predict is a future where there is a lot more innovation related to delivering patient care and providing visibility to patient outcomes or of patient outcomes to healthcare providers. Lisa mentioned telehealth. Just in the last month or two, we've seen all kinds of restrictions related to telehealth lifting up so providers can provide services across state lines now where they've not been able to do that before. We're seeing all kinds of innovation related to enabling patients to self-care at home and deliver information electronically to their physicians without having to leave their house and go into a doctor's office to take those vitals once a week or once a month or whatever that might be. I think there's a world of opportunity and innovation out there. And I think that the benefit to that is providing a measure of control back to the patient, right? And giving them more confidence in their ability to self-care and manage their care, or their caregiver's ability to manage the interactions that are happening with patients and physicians. So for us in the digital healthcare space, I mean, we'll be booming is what my hope is, right? But in the content space, what I hope that means is that it really challenges us to flex our ability to deliver information to come alongside and to accommodate those different areas of innovation. You know, what is the best way to communicate when you're in a telehealth situation? Great, there's a nice video conference with your with your care provider once you're on video, but what happens when that video is over? And there is an opportunity for our content strategists here, for sure in the healthcare space and beyond, to pay attention to how we're evolving, developing content to align with those new methods of delivery.
Yep, absolutely.
I don't need to talk about the term, but that's one of the things that AMA actually developed is a new telehealth, telemedicine implementation guide. And we also created a series. We had some special meetings with our editorial board for our medical codes, the current procedural terminology, and developed some new codes for telehealth. So I agree with you, Stephanie and Lisa, that's where I see things evolving as well with technology and in the digital space, and how we actually help on our end, help the physicians to be able to, work with the patients in that way.
Yeah, there's so many angles of communication to that. There's helping the patient understand the process. There's helping the physician navigate the process. Then there's the operations part of it. Like, how do we get reimbursed for this? How do we make sure, there's a lot of different layers of content that would need to be communicated. Absolutely. Kimberly, do you want to share your predictions? Do you dare? What do you think?
Well, I know right now we're in the throes of shifting for our events. We have a few signature events for the longest day and Walk to End Alzheimer's, but we also have an annual research conference. And this year it was supposed to be in Amsterdam, but now we're transitioning to a free virtual event. So we're expecting twice the amount of attendees, and we're making decisions, evaluating platforms to build it out in time, on top of changes to the site and the app and how these are all going to work together. So maybe in the future we might be evaluating, do we really need to have in-person conferences? Are we going to always have this virtual component to our events? And it's just really making us look at what's going to happen this year, how successful is it going to be, and that might inform the way we approach it in the future. And we also have research on hold right now. So when that is no longer paused, we're going to have an influx of work as we're getting new RFAs, and we'll just have a lot of changes to work through, and we might look at how we're approaching that, making sure it is more focused on the user, the researcher, the human, at the root of the search.